we have the capacity now to do between 450 to 600 tests per day, and we are working to take that up to maybe about 1,000 to 1,200 tests per day. So that work continues. So capacity at the National Public Health Reference Lab has increased. In terms of getting samples, that really has to do with the regions themselves going out and proactively um, testing people once they meet the criteria or they feel they were exposed. So those samples, once they come into the Public Health Reference Lab, we are able to process them. But again, it comes back to individual regions being more proactive in how they reach out to people and be aggressive in terms of getting people tested. We have seen some regions where this is happening very easily, and they have put up all the mechanisms, and they have been sending a lot of samples to the National Public Health Reference Lab. And there are other regions who have been sending less samples. We have been engaging them and pointing out to them that with the size of their region and so forth, that perhaps they need to be more proactive in doing testing and setting up other testing sites within the region. And so those measures are being taken. We've been trying to curtail spread within these regions and to slow the reproduction time, to slow the amount of people getting infected and so forth. Now, what that allows us is once we know um, how many cases we have, where they are, we can also anticipate with our health system how many beds we would need and how many people would require hospitalization and whether we'll have enough beds if people really get sick and they require hospitalization, whether we'll have the required beds to treat them. So over the last 2 months, 3 months, we have been working to ensure that we have adequate amount of beds in our regional hospital and the national hospital and the facility at Liliendal. We have been working also to make sure that we have critical care beds, meaning that you have equipment such as ventilators and so forth available if these persons require those types of interventions. So we have been putting that in place, and of course, trying to get the types of medication to treat COVID-19 once people become severe or critically ill.